Hello, my name's Frances Rice. I'm a professor at Cardiff University and I'm based at the Wolfson Centre for Young People's Mental Health. And the title of my talk today is Can Depression be Prevented in Young People? So in terms of the overview of the webinar, I'll just tell you a little bit about who I am and who my team is and what we do at the Wolfson Centre for Young People's Mental Health. Then I will define what we mean by depression in young people, highlight some key risk and protective factors for depression, give a very brief summary of some early intervention and prevention studies that aim to reduce depression. And then I'll introduce a study that we are carrying out, led from Cardiff University, but involving young people all over Wales and the UK, called the Skills for Adolescent Wellbeing study, which we're hoping to recruit 400 parents and carers and young people. So in terms of the research that we do at the Wolfson Centre for Young People's Mental Health, our aim really is to improve understanding of young people's mental health problems and really to try and use that knowledge to generate and implement evidence-based high-quality approaches to early intervention and prevention. And we aim to undertake good quality interdisciplinary research that can have the potential to improve the lives of young people affected by the conditions that we study. So that's particularly anxiety and depression. We have a number of partnerships with practitioners and with policymakers, and the idea of this is really to try and integrate scientific evidence into practice. And we also place a strong emphasis on training the next generation of mental health scientists. The themes of the Wolfson Centre for Young People's Mental Health are sort of organised really into 5 main scientific themes. So you can see them at the top along here and the lead. So the one that I lead focuses on interventions in young people who are at high risk. And then we've got themes spanning population mental health, genetics, mental health interventions in schools and patients. We have a cross-cutting theme around using the best quality methods, really to ensure that we're doing the best quality research that we can. And then we've got a number of things in place really to ensure that the research that we do is relevant to young people and also can get rapidly translated into policy. So the first is that we have a very active young people's advisory group. So these are all young people with lived experience, and they're involved in setting the priorities of the centre and advising us on the research that we do. We have Chris Eaton, who's funded jointly with Welsh Government, and that's really about linking knowledge exchange across the centre with government, and an implementation and engagement board, which comprises practitioners and policymakers, really making sure that our research is relevant and is translated into practice where appropriate. So this is the team of, or some of the team of researchers who are part of the work stream focusing on interventions in young people who are at higher risk of developing depression. So this is the SWELL study team, and it's a range of people who are practitioners, so clinically trained. So Olga's a child and adolescent psychiatrist and also a researcher. And Olga and Vicky have done a lot of organising of the setup of the study. Rhys Bevan-Jones, again, is a psychiatrist and a researcher. Jack Airdrie is our clinical psychologist. We've got a big team of psychological therapists, as well as a big team of psychology assistants and placement students. So we're based at Cardiff University across 2 sites on the Innovation Campus, which is on Maindee Road. So we're in the Hayden Ellis building and Spark building. And 1 work stream of the centre is based in Swansea. So in terms of the main bulk of the talk today, I'll first of all define depression. So mental health really exists on a spectrum. We all have mental health. We can be doing really well, or we can have some symptoms of a mental health difficulty that might cause us some distress. or we can have symptoms that are sufficiently severe and that cause a lot of distress and impairment in going about our daily life. So being able to work, being able to go to school, and being able to get on with people. And so it's quite helpful to think about this sort of spectrum. So mental health difficulties can be mild, moderate, or severe. They can cause distress to the person and those around them, and they can also interfere with young people's ability to go about their daily activities. So particularly with going to things like going to school, concentrating at school, getting on with friends, getting on with family. And it's only when people have symptoms that are sufficiently severe that cause distress and impairment that we say that somebody may have a mental health disorder. And there is this sort of continuum between, say, symptoms of depression and what we call kind of clinical depression, but there isn't this necessarily equivalence. Then in terms of how common depression is, about 1 in 6 young people in the UK have a probable mental health disorder, so symptoms that are sufficiently severe that cause distress and impairment. About 1 in 12 have a probable emotional disorder, so that's either an anxiety disorder or depression. But a lot more people have some symptoms that can be distressing or impairing, but that fall below that diagnostic threshold of what's required sometimes to access specialist services. This is a schematic, again, just to sort of show how common anxiety and depression are in young people. This is data from England. Boys are in the dark blue, girls are in the paler blue, and you can see that rates increase with age, but this is particularly the case in females. So older females are particularly affected by anxiety and depression. And there are other groups that show higher rates. So particular ethnic groups show higher rates. Young people with additional educational needs, young people who have a parent who's mentally distressed have higher rates, children whose physical health is poor, and also children from less well-off families also show higher rates of anxiety and depression. So what are some of the risk and protective factors for depression in young people? So depression, like lots of mental health problems, has what we call a common multifactorial set of causes. So this means that there's not one single cause. There will be many different causes acting together in quite complicated ways that, if you like, cause depression, and they can be social types of risks, psychological types of risks, or inherited or biological risks. But some key risk factors are sort of stressful or adverse experiences, and this refers across a whole wide range of experiences, from things like bullying, from conflict at home, right to the other extreme, to neglect and maltreatment. Also things like having difficulties with friendship, being from a poor family, are associated with a higher risk for depression. Things that happen within your family, so having a family member who has mental health problems, particularly in a parent, increases risk, and we've shown that that link is primarily through environmental rather than inherited roots. Pardon me. Sorry. And then there are also individual level risks, so things that affect individuals perhaps in their psychological profile. They may have particularly pessimistic styles of thinking, so they might be very self-critical. And then, as I've said earlier, there are certain groups of young people who are more likely to experience, and they don't necessarily fall into these different categories. In terms of what are protective factors, having good quality close relationships is really important, either with a family member or with friends. Again, individual psychological factors like having a positive outlook and thinking that you can handle things that life throws at you, being able to solve problems, so sort of being cognitively flexible, again, is a protective factor. And then certain types of behaviours, so for instance, taking part in regular physical exercise has been shown to be protective. So in terms of our research at the Wolfson Centre for Young People's Mental Health, we've had a particular interest for many years now in a group of young people who are vulnerable of developing depression and other mental health difficulties, and that's children and young people who have a parent or a carer with depression. And the reason that we're particularly interested in this group in our research is that having a parent or a carer with depression is a really common potent risk factor for depression in young people. So about a quarter of young people have a parent with a known and treated common mental health disorder. Nevertheless, there's sort of variability in the absolute levels of risk for individual young people. So there is an increased chance that young people would develop depression if their parent suffers from it, but there's variation. And we also know from many years of research that this population of young people are relatively easy to identify because their parents are often known to health services, but actually that they represent a major lost opportunity for intervention because they don't seek help even when they've got overt mental health difficulties. So this is a group that could really benefit from early interventions. So next, I'll just give a brief summary of existing early intervention and prevention studies that aim to reduce depression in young people. So the sorts of things that studies have done is, first of all, to give skills type training to young people in order to equip them with skills that they can use to, if you like, withstand the stresses and strains of life. You can also try and reduce exposure to known risk factors. So there's some quite interesting early work looking at whether if we get better at treating depression in parents, can that have knock-on benefit effects on children and on families? And there's some early evidence to suggest that maybe it can. And then there's another strand of work that really focuses on trying to enhance protective factors. So there's a few studies now that have come from the UK and also internationally that are focused on trying to strengthen the sense of young people's sense of belonging to their school as a sort of known determinant of mental health and health behaviours. And there's these different types of approaches, and different approaches are better suited to different groups of young people and also different types of study design. So for instance, whether you target an intervention at a particular group of young people who might be most likely to benefit from it, versus that you deliver something that is made available to everybody, so universally, and not targeted at a particular group. So for instance, the school belonging studies have tended to take this more universal approach, whereas the skills training studies have tended to take a more targeted approach. And the evidence that I'll summarise next really comes from what are called randomised controlled trials, which many of you will be familiar with. And essentially what I've tried to do is show a schematic here about how a randomised controlled trial works. So you've got participants through the process of randomisation. So here it's throwing a dice. Participants are allocated to either receive an intervention or to be in the control group. And the intervention might be, for instance, some online psychological therapy and any treatment as usual, and the control group might be a treatment as usual group. And then you're looking to see what the difference in your outcome of interest is between your control group and your intervention group. And here I've shown the outcome with these little hearts. But essentially, the reason that randomised controlled trials are important is because they're the highest levels of evidence for the effectiveness of an intervention. And that level of evidence is very important in persuading policymakers and budget holders that there is a case to be made for implementing an intervention in standard practice, for instance. So that's why they're very important. So I've synthesised here the results from all the randomised controlled trials looking at depression prevention in young people. I've kept the sort of technical stuff out. But essentially what the data shows is that for depression prevention, targeted studies that focus on young people with existing risk factors, so for instance having a parent who's depressed or who have high depressive symptoms, are the interventions that work best. Those are the ones that have the largest effect size and are most beneficial. Most of those types of interventions use what I call a skills-based approach here. And so what they aim to do is to provide information about depression, but also teach useful skills that people can use in their everyday life. So one useful skill might be how to challenge negative thoughts and introduce more balanced thinking. Another useful skill might be how to solve interpersonal problems. And one of the reasons that these targeted approaches to prevention might work better is that perhaps you need some symptoms in order to really engage with the intervention content, or to be very motivated to complete the intervention content. And then there's one intervention that's particularly interesting. It's the intervention that's shown the largest effect size in terms of the largest reduction of depression. And it's also the only intervention that's been shown to have long-term beneficial effects. So most studies really only follow people up for a short period of time, but this study has been shown to have beneficial effects over a 5-year period. And this study used an intervention called the Coping with Stress intervention, and it focused on a very targeted group of young people. So young people who had a risk factor, so young people who were aged 13 to 17, who had a parent who suffered from depression, and they either had current high symptoms of depression or they'd had a previous episode. So they're not in a current episode of depression where we might more appropriately refer them to treatment, but they're at high risk based on a risk factor and the presence of elevated symptoms or a past episode. So it's sort of a group who may be particularly keen to engage with the content. So let me introduce this Skills for Adolescent Wellbeing study that we're doing, led from Cardiff University, and it's really an early intervention or prevention study. So what we've done for the SWELL study is we've adapted the Coping with Stress intervention, so which is the intervention that shows the best evidence that it can reduce depression in the longer term. And we've tried to adapt the study so that we can optimise how effective it is, so make it even more effective. And also we've thought about sort of thinking about what capacity there is to support mental health and the levels of need. So we've thought very hard about future implementation. And so, like, for instance, with that in mind, we've adapted the intervention so that it can be delivered entirely online, thinking about how we might implement this in the future if it's shown to be effective. So we focus on a high-risk group, young people whose parents have had depression. We're also offering extra treatment for parents who have significant depressive symptoms when the study starts. So they will have the offer of having some specialist treatment as part of the study. Once that's completed, the young person's then randomised to either receive this online cognitive behavioural therapy programme facilitated by a therapist, or they're randomised into the control group. So both groups are able to start any additional treatment that they may require. That's obviously done with ethical considerations in mind. And so our aim is to see if this SWELL intervention can reduce the rates of clinical depression in young people, and also to test if the intervention influences a number of secondary outcomes. So those include a range of mental health problems and things like quality of life. We also want to understand how the intervention works and if there are any barriers to it working. And clearly, once the study's completed, it will take a few years. We want to share the results of the study to relevant partners, particularly thinking about any future implementation of the intervention. So who can take part? So it focuses on this high-risk group of young people who are aged 13 to 17, and we're looking to recruit parents and carers who've experienced depression and their teenage children. And young people and parents will take part in the study, and they'll also complete questionnaires and interviews, so at 3 time points across a 9-month period. So why do we think people might be interested in taking part? So parents who are depressed get offered this specialist treatment, and we know that often people experience difficulties in sort of accessing optimal care, and so that might be appealing. Young people get the chance to take part in this psychological intervention facilitated by a therapist who's got lots of experience in delivering interventions to young people. So again, that might be appealing. And we know that people's time is valuable, and we're asking for a commitment from people who take part. And so each participant will get at least £60 in vouchers for completing the study. And if they choose to take part in some optional extras, they'll get additional compensation. I wanted to just point out that we've involved young people with lived experience of anxiety and depression in the design of the study, and they're also involved in the independent oversight of the study. So this is very important to us, and they've really inputted a lot into this. We're recruiting through a number of different routes. The study's been reviewed and approved by all the relevant NHS and health-related authorities. And we've been recruiting through primary care, through mental health support teams for NHS workers. We're beginning to recruit from secondary schools, asking them to advertise the study to parents, and advertising through face-to-face and social media is also an important route for us. So how could you support the study if you were interested in doing so? You could send a letter or an email about the study to parents of pupils who are aged 13 to 17. You could display posters about the study or post on social media channels. But sort of outline some of the potential benefits for young people and for parents. But in terms of potential benefits for schools, one thing might be that being seen to be offering and supporting the offer of additional mental health support to families who need it, demonstrating and leading collaborations with local universities and championing research, and then also really supporting the advancement of mental health research through collaboration. And we're really keen to collaborate with schools where schools are able to do that. So if you're interested in supporting the study, please get in touch with us. And I've also included my email on here. So if you're interested in receiving some additional information or asking questions, then please get in touch. Thanks very much.